According to the World Health Organization, 3 in 10 people experience post-traumatic stress disorder. This condition affects both gender. Today on the program, we are taking a look at what exactly is post-traumatic stress disorder and how to manage this condition. Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. The conversation begins after this break.
We have completed a national risk stratification exercise, categorizing states according to the likelihood of Ebola importation based on international points of entry, population mobility patterns, and border connectivity. This risk-based approach is guiding preparedness activities across the country. We have developed nationwide dissemination of Ebola case definitions, mostly to case managers like doctors, nurses, and people in surveillance areas. Case definitions, surveillance protocols, contact tracing procedures, and self-quarantine guidance, and traveler monitoring protocols to strengthen early detection and rapid. While there are currently no widely available licensed vaccines and approved targeted treatments, specifically for this strain of virus, experience from previous outbreaks has demonstrated that early detection, rapid isolation, infection prevention and control, contact tracing, risk communication, and effective emergency coordination remain the most effective tools for preventing transmission and saving lives.
The NCDC Director General further urged healthcare workers across the country to maintain a high index of suspicion, especially when attending to persons with recent travel history to affected countries.
We're encouraging Nigerians to remain calm. I say again, do not have any case of Ebola in this country. They should remain calm and continue their normal activities. However, they should also obtain information only from credible sources. Avoid spreading rumors and misinformation. Practice good hygiene, the same thing eyepiece, hand washing, proper sanitation. These are key. And promptly report any unusual illnesses through established public health channels.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening to talk about post-traumatic stress disorder is Adebukola Adeogun. She is a mental health nurse practitioner, and she is going to let us know all we need to learn about post-traumatic stress disorder. Good evening, Adebukola Adeogun, and thanks for joining us.
Thank you. Good evening. How are you?
I'm fine. We are looking at a mental health condition now. The World Health Organization says about 3 in 10 persons worldwide experience this condition. How did we get here, and what exactly is the cause behind post-traumatic stress disorder?
Yes. So, post-traumatic stress disorder. We have to understand at first that this is when somebody experience one form of trauma in their life. And when post-PTSD, when it was initially put on a DSM, they were looking at veterans that went on war, they experienced, traumatic events during that time. But after, I think in the 70s, then they now know that not only veterans experience that, other people that are not veterans also experience post-traumatic stress disorder. So, to answer your question, there are a lot of risk factors that put people to experience that. And that would be if someone has gone through sexual trauma in their life, people who have been abused, either as a child or as an adult, or any form of sexual abuse. Domestic violence. People who are in toxic relationship, they have high risk of experiencing PTSD. Also, socioeconomic too. Your environment can put you into that. Imagine a child living in a violent environment. All the child sees is violence, and that can have a long-term effect on them, and they can have PTSD from that. And so, I mean, a lot of things can put us into high risk to experience PTSD.
All right. So, does this condition start, or experience such moments immediately the life-changing events happens or occur, or soon after?
Unfortunately, sometimes it doesn't come out. For some people, it comes out years after. And because it's very kind of, the symptoms is close to having depression or anxiety, they may be misdiagnosed and thinking that the person is having depression. Because the symptoms is similar to having depression. You having increased mood swing, just not interested in anything. And so, to answer your question, it doesn't mean it will show as soon as they experience that. And that is why some people, it takes them years. Children who have been traumatized as a child may not even know that the events that happened when they were, as a child, is causing the problem as an adult. So this can happen even years after. They can still go through these PTSD symptoms.
All right. So, can this condition be triggered by another event? Because you pointed out earlier in your explanation that some children, because of their memory or at that early stage, might not even remember, but something keep triggering the effect or disorder in them.
Yes, very well. That's Imagine someone who was sexually abused as a child. Um, Definitely they lose trust on people, especially if it's a family member, and they may not even know that that is the problem they're having when they go into relationship having trust issue. um they don't want to be alone with anyone, or they don't even want to associate with people. They isolate themselves. So yes, it can, it it can be some kind of a problem for them in a society due to the PTSD they experience.
Is this condition more common in men or women?
It's actually more common in female than me, and according to research, um, hormonal factor, biological factors make it more common in female because we already have our hormones that causes a whole lot of a mood issue for us. Then having a traumatic event may make it worse. So it's common in female than male.
Okay, are there cases where this condition can be treated or just managed, or you just have to live with such condition?
It actually can be treated, and usually we want to treat the symptoms. So when we talk about PTSD, then we'll say what are the symptoms? What are the symptoms of the PTSD? Those symptoms includes, we want to treat the symptoms such as nightmare flashbacks. They have medications that can be given for nightmare. We also want to treat the increased, symptoms of depression or anxiety. And another symptoms would be avoidance or intrusive thoughts. So we combine treatment with therapy. So we do psychotherapy and medication to help someone who is going through PTSD. Sometimes when we try to treat with therapy and medication and it's not effective, some people may even have resistance to treatment in regards to depression. So we'll do different options. They check for the level of serotonin in the brain. We'll try to give them medication. Mostly when you treat PTSD, you give medication, antidepressant medication to help with the serotonin level. So yes, we we do all different lab tests, make sure that their vitamin D level is not low, because lack of vitamin D level has been associated that can affect the mood. So different treatment options are there and tests to be done.
All right, there is a whole lot of stigmatization surrounding mental health. How do you want people to address this, especially people living with such condition?
I believe in education, educating and educating, and you cannot overemphasize on, awareness, telling people how to what to expect, symptoms that they are going through, and what they should do, talking to people. So it is very important that we educate people. When you educate people, they know that they're not alone, and they are able to get resources to help them. They will be more comfortable to come out and talk. And an example would be someone who was sexually abused in an environment where it is it is hard for them to voice out that they are abused because of stigmatism. They may want to keep it quiet, and keeping that quiet is affecting them and is getting them to be more traumatized, because every time they come in contact or the event reoccur, it makes them to be more traumatized. So that is why it is important that we educate people and let them know that it is okay. They are not alone. There are lots of people who are going through the same thing that they are going through. And talking to someone, having a therapist around them will make things better for them.
As a mental health expert, let us know self-tips people living with PTSD and other mental health can embrace.
What I will advise usually is, if you are experiencing PTSD, you want to first find a professional that you want to talk to. In an environment that you don't have one, you have people around you that you feel you trust and want to talk to them and tell them about your symptoms. If you're having anxiety, I'll always encourage people to walk, do exercise, things that will help you, that will relieve your anxiety. Walking, listening to music, calm music, that can help you to decrease your anxiety level. If it comes with depression, find things that you love to do, that you enjoy doing. First thing you want to think about, when was the last time you did something you actually enjoy doing, that gives you joy? You want to find out, and if it's been a while, you want to do it. Keep good company, people around you. Support yourself with people that will support you, will elevate you, that will bring your mood, that will try to bring your mood up. Stay away from negative things. Also, alcohol, drugs, you want to stay away from it. All that will worsen your situation. So as an expert, I always encourage patients to make sure that they do things that gives them joy, they keep good company, they talk to professionals that will help them in their journey, and find out resources, people that are going through the same thing that you've gone to. If you're religious, if you're a religious person, take that very, very important, because we undermine what religion can do for us. When you see yourself giving back in the church or in the mosque, it helps you to know you belong somewhere. People, you are giving back to the society. It gives your ego, it gives your mood, it brings it up. It helps you to know that you are doing something worthy in the society. So all that, and plus, eat right, decrease the amount of sugar, because sugar it's not good for the system. You eat healthy, exercise, all that will help you.
As we wrap up now, let's have your final words.
We have to understand that mental health is a very serious illness. Unfortunately, it's way overlooked. We don't pay attention to it because because it's your words against mine. We are not seeing numbers. So when people say they're having mental breakdown, people look at them like, what do you mean mental breakdown? You're walking around, or you have money, you're rich, you're able to take care of yourself. Why are you complaining? It is real, and we should take it serious. So we pay attention to not just for us, people around our loved ones. When we see changes in them, we need to pay attention to them and help them to seek help early so it doesn't go, it doesn't become worse. That would be my advice to people.
Adebukola Adeogun, mental health nurse practitioner. Thank you so much for your clarification and reassurance for people living with post-traumatic stress disorder.
Thank you for having me.
Right, Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. Mental health is not a taboo. It is just like other health conditions, heart diseases, hypertension, and non-communicable diseases. You need to seek help early enough. Do not stigmatize people living with mental health, whether it is post-traumatic disorder or postpartum disorder. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 08035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. And make healthy living your choice.